Scottish Government whether it will provide an update on the cyber attack on the 4th of August 2022, which reportedly targeted NHS Scotland's patient management software?
Cabinet Secretary Humza Yousaf.
On August the 4th, 2022, we were alerted by NHS National Services Scotland that one advanced service provider for health and social care across the UK had experienced a cyber attack. The UK-wide incident was contained by the supplier within a few days, supported by the National Cyber Security Centre. Regular public updates on the cyber incident and subsequent recovery were reported by the supplier, One Advanced, covering all systems impacted. The Scottish Government commented publicly at the time. The target for the cyber attack was One Advanced and not NHS Scotland health boards. The Adastra system used by out-of-hours GPs in Scotland, which was the main system impacted up here, was brought back online in October. Let me make it clear, Presiding Officer, no NHS Scotland patient data was affected, and well-established contingency arrangements were in place to sustain effective delivery. All One Advanced systems have been tested and security checked, with close working by NSS with the National Cyber Security Centre and the ICO. I want to express my sincere thanks to everyone who's been involved in responding to this incident so swiftly.
Tess White.
Following the attack, NHS staff were forced to keep patient records on paper and in emails and in Word documents. There are serious implications for patients' safety, privacy and trust. Can the Cabinet Secretary confirm the scale of the data breach, including the number of patient records that were affected by the attack, and what measures were put in place to keep patient data safe as digital systems were restored?
Cabinet Secretary.
So let me just confirm what I said in my statement or my response just a moment ago, that no NHS Scotland patient data was affected. And also, importantly, this is a really important point that Tess White has rightly raised, that there was contingency absolutely put in place. So first of all, core systems, they were fully restored, and ongoing monitoring by Scottish Government resilience officials was very much in place. And we were working, I should say, on a four nations basis. This was an attack that affected every part of the UK. Local arrangements were also put in place to ensure resilience. And the contingency arrangements used had been in place for many years. They're well understood by both NHS 24 and indeed the service. Contingency arrangements included updates to in-hours GP records in line with standard processes. So the attack took place. The contingencies that have been well rehearsed and well known about were put in place, and I'm pleased, as I say, that no NHS Scotland patient data has been affected.
Tess White.
Presiding Officer, the alarming reality is that with ongoing geopolitical turbulence, we're seeing more and more malicious attacks like these, and healthcare is clearly in the perpetrators' crosshairs. How confident is the Cabinet Secretary in the resilience of health boards to defend against future attacks? And does the Cabinet Secretary agree with the former Digital Director of NHS National Services Scotland that the NHS needs to up its game in the face of serious cyber attacks?
Cabinet Secretary.
So again, Presiding Officer, can I thank Tess White, forgive me, for what is an exceptionally important question. She's absolutely right to say that there are improvements to be made right across the board, and particularly across Scottish Government, across public sector. But we are committed to ensuring those improvements around cybersecurity for all the reasons that Tess White rightly raises in relation to state actors as well as non-state actors. What I would give Tess White some reassurance around is that we work exceptionally closely with the National Cyber Security Centre. They, of course, advise right across the UK in relation to cyber security, and we have a contingency in place to deal with any attacks that do take place. So there's ongoing work. We work individually with health boards too, and again, I'll be quite frank and honest with Tess White in my response that there are some boards who need that further work from, need that further support from Scottish Government, and we're providing that support.
Paul O'Kane.
Presiding Officer, it is shocking that this Parliament and, more importantly, the public may not have been aware of the scale and severity of the cyber attack had it not been uncovered in detail by a Freedom of Information request from Scottish Labour. It raises significant questions over transparency. Even by the standards set by his SNP predecessors, the Health Secretary's report card is shocking. In 2017, following the last major cyber attack on NHS systems in Scotland, the then Health Secretary, Shona Robeson, came to this chamber, made a statement and pledged to launch an inquiry so that lessons could be learned. So can the Cabinet Secretary explain why he failed to come to Parliament and make such a statement? And furthermore, can he explain what impact this cyber attack has had on waiting times and figures in NHS Greater Glasgow and Clyde?
Cabinet Secretary.
As far as I'm aware, it's had no impact, but I'm happy to look into that and come back to Paul O'Kane with further detail. What I would say to Paul O'Kane is, of course, this cyber attack was reported in August by STV News, by BBC News, by The Guardian, by the Nine political programme, which I think Paul O'Kane, I'm sure, has been on numerous occasions, all in August. And of course, the Scottish Government commented publicly at the time. I will double check my records, but I don't think since that report and that very public, extensive coverage of the cyber attack in August, in the intervening 4 months, I don't think I have had a single parliamentary question from Paul O'Kane, single piece of written correspondence about the cyber attack on Paul O'Kane, or a single request for an urgent statement from Paul O'Kane. If I have, and I stand to be corrected, I will, of course, correct the record. So while I am concentrating on my job within the Scottish Government, I'm afraid I cannot do the opposition's work for them.